Winston Churchill said, "We make a living by what we get, but we make a life by what we give." Imagine living in a world where every person gives a little something of themselves to others. Not in terms of money, but in terms of your time and skill. I do believe that if we can achieve this, we can change the world. And I want to live in a world like this. In my life, I have found that when things fall in place very swiftly and out of nowhere, that they are meant to be. It's moments like these that remind me that the best outcomes arise when we least expect them, reinforcing the idea that everything happens for a reason. This is how I started the Dr. Answa Foundation. It's the day I met this little girl. Her name is Lolita. Who would have thought that this encounter would start a wildfire of events that up unto this day I cannot explain, but it has changed my life forever. Lolita's life took a tragic turn at the age of 8 when she was viciously attacked by the family's pit bull, leaving her face disfigured and her innocence shattered. A year later, Lolita and her family had to relocate from their hometown. Her parents separated, her mother lost her job. They were staying with family in an informal settlement, and Lolita and her brother was not attending school. But Lolita's story is not a story of tragedy and despair. It's a story of hope and possibility. When I met her, I realized that I can help her. So my thought was to get her into my practice once a month and do scar revisions one at a time. I discussed this with a plastic surgeon and a dear friend of mine, and he said the first prize would be if we could actually get her into a theater, make her sleep, and fix her whole face all in one go. I asked if he would help me, and he said yes. That same day, I asked our regular anesthetist if she would help us, and she said yes. Obviously, Lolita's family could not afford such a procedure because they do not have a medical aid. And the local provincial government hospital cannot assist with this kind of operation. Next, I needed a theater. This was my biggest hurdle. 2 days later, I had a theater, free of charge. From the day I met Lolita until the day of her surgery was less than a week. Who would have thought doctors actually became doctors to help others? So I pledged that I would help one person per month with a reconstructive surgery case. The satisfaction of that day of helping Lolita will stay with my colleagues and myself for the rest of our lives. By the way, Lolita went back to school. She's absolutely flourishing. Her mother has a steady job, and they are living in a beautiful house. So I noticed the following. There is an incredible gap in our country's healthcare system, specifically in terms of reconstructive surgery. Not a life-threatening condition, and definitely not a priority for theater time. But this is a problem. It's a problem for people without a medical aid to get the surgery that they need, the surgery that will change their lives forever. This begs the question, can a single person with a single skill set change a system? I do believe that the answer is yes. My experience have shown that individual actions can lead to systemic change. mothballed government facilities due to a lack of funding is a reality we see far too often. State-of-the-art theaters sitting idle while people suffer due to a shortage of personnel. But it doesn't have to be this way. My vision is to make underutilized theaters active again through a dedicated team of doctors and nurses who come once a month. They give their time. I'm not saying that medical professionals should work free of charge all the time. We all need to make a living. But what I am saying is help once a month. Help one person per month. You can do this in your own practice. We have had a tremendous collaboration and victory with our provincial government hospital here in town. Due to budget cuts, only 3 of their 5 theaters are currently in use. So our team comes once a month, we do a reconstructive case, and then our team we stay there, and we help with the overflow and backlog of their surgical cases. I know what you're thinking, and I was thinking the same, is how can once a month make a difference? But it does. It makes a difference for that little boy of 6 years old lying in a bed in a hospital for 2 weeks with a femur fracture to finally get the surgery that he needs. It helps for that reconstructive surgery case to get the life-changing surgery that will go with them for the rest of their lives and change their lives. And that's what it's all about. Every person counts. Imagine if every operating room is a beacon of hope. If every surgeon is driven by purpose, not by profit. This is a world we're striving to create, one patient at a time. Since Lelita, we have helped a couple of other people. We have helped Melvin with keloids, Drika with her arms, Nikki, who had a disfigured arm due to a motor vehicle accident, Alroy with a lipoma on his forehead, Brian with a large cancer on his nose that needed a forehead flap to cover his nose, Ava with burn wounds, Shafika with moles inside of her eye and on her nose, Karen with a dog bite, Mila with a prosthetic leg, Christiana with intropion, and Gerard with a corneal transplant. We help. We help for free once a month. Would it not be wonderful if our story can inspire others to do the same? Help one person. Anyone can do this, no matter your vocation. You can be a lawyer, you can be a teacher, you can be a housewife, you can be a student, you can be a plumber, you can be an electrician, you can be a business person. This will change your life if you make a decision to help one person per month. If we can do this, we can change the world. And I want to live in a world like this. I want to change the world.